Committee will come to order. We'll start with opening statements. We want to welcome our guest, and we'll introduce you here in just a few minutes and give you your opportunity for an opening statement and then to questions. But you know how these things typically work. We got to listen to the politicians first before we get to listen to the experts. But we're going to start with the gentleman from Alabama with an opening statement. Then we'll go to the minority side, and then I'll have some brief remarks, and we'll get right to you. So the gentleman from Alabama is recognized.
Thank you, Mr. Chairman. Thank the witnesses for being here today. The Supplemental Nutrition Assistance Program, otherwise known as SNAP, offers assistance to millions of Americans who cannot afford nutritional food for themselves and their families. And there are over 45 million Americans who rely on this program. SNAP administers the program. The Food and Nutrition Services administers the program in partnership with state agencies, but nearly all the funding comes from the federal taxpayer. In 2017, we spent over $70 billion on SNAP and other food programs, and with a program of that size and that price tag, it's essential to apply the highest standards of program integrity. The committee has worked to expose a pervasive problem of improper payments in our federal programs. This is an issue that I've paid particular attention to, given that last year we had $140 billion in improper payments, which I like to remind my colleagues that that's money we had to borrow and pay interest on. In fact, improper payments are, as I said, rampant throughout the federal government. It's not just this program. The Office of Management Budget designates SNAP as among its highest risk programs due to the estimated dollar loss through improper payments. The Food and Nutrition Service agent provides state agencies with bonuses for having low error rates and penalizes those with high ones, but that, I think, has not exactly been the right incentive for solving this problem of improper payments. In 2017, state agencies in Virginia, Wisconsin, Alaska admitted to False Claims Act violations for fraudulently reporting low error rates to exploit this bonus system. This committee is working on a better way to incentivize federal employees, federal agencies and programs to report on the improper payments and to try to solve this problem. Combined, these three states had to repay over $16 million in fraudulently earned bonuses, and other state agencies are still being investigated. One of the most frustrating aspects about the program is the lack of data transparency produced from the prior administration. In fiscal years 2015-2016, data quality was so poor in over 40 state agencies that the Food and Nutrition Services decided it could not publish its annual national payment error rate. That's a major problem. It means for a full 2 years, at a critical time for helping those grappling during the recession to put food on the table, the American public was left in the dark. The Food and Nutrition Services has not published a national payment error rate since the fiscal year 2014. If you can't see how bad a problem is, if you don't understand how bad the problem is, you cannot possibly fix it. You can't get to a solution. The national payment error rate for 2014 was 3.6%, which accounts for $2.1 billion in overpayments and $500 million in underpayments. That's what we've been operating on for over 3 years now, lack of data. Today, we may hear how infrequent fraud is in the SNAP program, but perhaps it's not frequent because it's not appropriately measured. As reported by the USDA Inspector General, the Food and Nutrition Services has not established how states should compile, track, and report fraud in a uniform manner. The federal government cannot possibly grasp the scope and frequency of fraud in the program until we figure out how to report it. We also got a problem with the trafficking of SNAP benefits that diverts federal money away from the intended purpose of providing nutritional meals to those in need. Food and Nutrition oversees retailer trafficking, where some store owners have been found to illegally redeem over $1.2 million in SNAP benefits. Just a few weeks ago, investigators concluded a multi-year investigation, Operation Halfback, finding hundreds of people and businesses trafficked almost $4 million in SNAP benefits, some of which went to purchase guns and drugs. We've also noticed loopholes in the Food and Nutrition Services regulations where retailers who have been permanently disqualified from SNAP for trafficking are still in the system. If someone owns a second SNAP certified store, they are still eligible to receive SNAP benefits from their non-disqualified store. So make no mistake, our fellow Americans deserve a helping hand in times of hardship, but waste and fraud take this assistance straight out of their hands and put it into the hands of people who don't need it and who are abusing it. I look forward to hearing solutions from our witnesses today to bring sustainability and integrity to the program. For that, Mr. Chairman, I yield back.
I thank the chairman. Will now turn to the ranking member from Maryland, Professor Raskin.
Mr. Chairman, thank you so much for calling this hearing, and I want to thank the witnesses for appearing today, too. SNAP is, of course, America's most important anti-hunger program. It reduces poverty and food insecurity and improves health and economic outcomes for more than 42 million Americans, especially children. People receive an average of $1.40 per meal through the SNAP program, and in order to be on it, you have to complete a detailed application and provide documentation on your income, identity, immigration status, and address. Nearly 90% of people on SNAP belong to households with children under the age of 18 or elderly persons over 60 or a family member with disabilities. In my home state of Maryland, over 696,000 people benefit from SNAP. In my district, it's 15,000 households. SNAP allows families to purchase nutritious meals in retailer locations, including farmers markets. This is a program that I think matters to every member of Congress. Americans in every single congressional district benefit from SNAP. I looked at all of our districts, Mr. Chairman, and there are tens of thousands of our constituents who are on the SNAP program. The hearing occurs 1 week before the 2018 Farm Bill is slated for consideration on the House floor. That bill would impose dramatic new requirements that would effectively stop more than 2 million Americans in need from receiving food aid under SNAP. That comes after the House passed a $1.5 trillion tax cut that will give the wealthiest 1% of tax filers $84 billion in 2019 alone. As it turns out, the tax cut recently enacted could finance the entire SNAP program for nearly a year and a half. In fiscal year 2017, the cost of the entire SNAP program was $68 billion. So I find it touching that we can give away billions in tax dollars to corporate investors who don't actually need it and don't have to prove that they're even working to receive their tax bonanza, while at the same time planning to increase work requirements and cut food aid for Americans who are going hungry. I know that some will try to justify cuts to SNAP with allegations of fraud and abuse, and undoubtedly there are corrections that can be made to the 3% of payments that are wrong. More of them, I understand it, underpayments than overpayments. But in fact, SNAP is one of the lowest fraud rates in the government at less than 5%. Over the last several years, the U.S. Department of Agriculture has taken aggressive steps to improve SNAP oversight and to work with states on rooting out waste. USDA has brought down the rate of trafficking to about 1% of benefits over the last 20 years. While all of us agree that waste, fraud, and abuse need to be rooted out, I think there are clearly other places in the government we could be looking. Mr. Chairman, I'll just close on that thought that we had a hearing that found that there were $125 billion in immediate savings that would be available by cutting waste at the Pentagon, and I would hope we'd be able to focus on that too. I yield back.
I thank the gentleman. Now recognize the ranking member from Illinois for his statement.
Mr. Chairman, thank you so much for holding this hearing. I'd like this committee to help improve how the government serves the American people. We should start by recognizing the enormously important public service provided by the Supplemental Nutrition Assistance Program, otherwise known as SNAP. SNAP feeds 42 million Americans who face hunger and food insecurity. In my own district, the 8th Congressional District of Illinois, SNAP provides meals to nearly 28,000 households. In fiscal year 2014, 69% of SNAP participants were families with children. SNAP is vital to America's low-income children. No other nutrition or income support program reaches as many at-risk children or contributes as much to helping very low-income households who have children. SNAP's value far exceeds its cost. This year, for households in the program, SNAP will cost just $262.72 per household per year. According to the Center on Budget and Policy Priorities, SNAP averages just $1.40 per person per meal. These meals are crucial to sustaining these indigent families. I know what I'm talking about because I have personal experience with SNAP's predecessor, the food stamp program. I came to our country with my family from India when I was 3 months old so my father could pursue his engineering education and our family could embrace all the opportunities that America has to offer. But despite my family's best efforts, it wasn't easy and there was struggle. When my family needed help, thanks to the incredible generosity and goodwill of the people of America and its government, we were allowed to be put on food stamps. Today, my father is an engineering professor, my brother is a doctor, and I'm honored to represent the people of Illinois' 8th Congressional District. That's the American dream, the promise of a middle-class life with the opportunity for your children to have even a better life than you did. That dream was possible for my family because of my parents' hard work and the opportunities our country makes possible. But it was also possible because of food stamps. For families like mine and millions of others, SNAP and its predecessors have served as a critical social safety net and allowed us to bounce back from financial hardship. I believe that we must root out any fraud, waste, or abuse in SNAP and any other government programs for that matter. According to the United States Department of Agriculture, Food, and Nutrition Service, for fiscal year 2014, 3.66% of SNAP benefits were issued through improper payments. 3.66%. I should say that any amount of fraud, waste, or abuse is too much. That's why I believe that the goal of our oversight committee should be to eliminate even the smallest amount of any improper payments, whether it's in SNAP programs or any other government expenditures. But I strongly disagree with any attempt to exploit common ground, that is common ground to root out waste, fraud, and abuse, to justify severe cuts to our nation's premier anti-hunger program that serves millions and millions of women, men, children, seniors, and disabled Americans. I believe firmly that the best anti-poverty job program ever created is a job, a job. But I also believe that it is wrong to allow our most vulnerable citizens to go hungry. I hope that the witnesses today will shed light on how to improve SNAP program integrity without building greater barriers to helping Americans who would go hungry. Thank you, and I look forward to your testimony.
I thank the gentleman. I want you all to imagine a scenario that I think could play out in every one of our districts later this afternoon. There's a guy who works second shift at the local plant. Remember, when you work second shift, you miss half your kids' Little League games, you miss some of their after-school activities. But here's a guy who's working hard for his family, goes out to get in his truck to drive to work, and as he's getting in his truck, he looks a couple houses down, and he sees a guy sitting on the front porch, drinking coffee, reading the paper, and the second shift worker knows the front porch sitter can work and won't work and is getting his money. And as he gets in his truck to drive to work, thinking about the guy back on the front porch, he's got the radio on, happens to be the news hour. The reporter comes on and says the federal government's got a $20 trillion debt. They got some crazy program giving money to favorite corporations. This one company went bankrupt, cost the taxpayers millions of dollars. He hears all that, remembers the guy back on the front porch, and guess what? This guy's ticked off. And I would argue he has every right to be mad. Same time he's driving to work, there's a lady driving home from work, teaches second grade at the local school. She, like any good teacher, has busted her tail all day long to help her students. She's driving home from work, happens to have the radio on, happens to be on the same station where she hears the same reporter say the federal government's got a $20 trillion debt, they got some program, gives money to some connected corporation, this company went bankrupt, cost the taxpayers millions. She hears all that as she pulls into her driveway, which just happens to be on the same street, and she sees the same guy sitting on the front porch, drinking his coffee, reading the paper. She knows he can work and won't work and is getting her money. And guess what? She's mad too. And I would argue that second shift workers and second grade teachers are tired of this approach we have to social welfare, which says to some people who are able-bodied adults, some of them who are even able-bodied adults with no kids, you don't have to do something to get taxpayer dollars. So I know over the next hour or so, we're going to spend a lot of time talking about the 40 million people who get food stamps, and that's appropriate. We need to. In some cases, it is a very good program helping people just like the ranking member talked about his own family. But I think we also have to remember the 260-some other million folks in this country who are paying for the program. And it's not too much to ask to say, if you're getting a benefit from the government, you should have to do something to receive that. After all, it's hardworking taxpayers' dollars that we're talking about. So I say all that, I hope to set a little context for the next few hours as we talk about this important program and as we move into a debate on the Farm Bill, where we talk about reauthorization of the SNAP program. With that, I'll turn to our witnesses, and we'll start with, we first have, let me introduce our witnesses, then we'll go to that. Let me start with Mr. Brandon Lips, Administrator of the Food Nutrition Service and Acting Deputy Undersecretary of the Food Nutrition Consumer Sciences, Consumer Services, as I'm looking for my glasses, at the U.S. Department of Agriculture. Mr. Lips, we appreciate you being here. We have Ms. Kathy Laren, Director of Education, Workforce, and Income Security at the U.S. Government Accountability Office. We appreciate you being here with us, Ms. Laren. And Mr. Sam Adolphson. Adolphson? Did I pronounce, where did I put the accent? Say it again.
Adolphson.
Adolphson, all right, put the accent to the right place. Senior Fellow at the Foundation for Government Accountability, and Ms. Stacy Dean, Vice President for Food Assistance Policy at the Center for Budget and Policy Priorities. We have we swear you in here, so if you'll all please stand, raise your right hand, we'll do this. Do you solemnly swear or affirm the testimony you're about to give is the truth, the whole truth, nothing but the truth, so help you God? Let the record show each witness answered in the affirmative. We need to, do we need something from Mr. Gianforte? Yes. Unanimous consent that Mr. Gianforte be able to participate in all aspects of the hearing. We're glad you're here. And the ranking member is recognized for a motion.
Mr. Chairman, I'd like to submit 2 letters for the record, one from EPIC.org, that's the Electronic Privacy Information Center, and the other from the Network Lobby for Catholic Social Justice.
Without objection, so recognized. And so now it's time to, we'll go right down the line here. Mr. Lips, you get your 5 minutes, and you know how it works. Try to keep it under if you can. If you go over, don't go much over. And then we'll move down the list, then we'll come back to questions. Gentleman is recognized.
Good morning, Chairman Jordan, Chairman Palmer, and Ranking Member Krishnamurthy, and members of the subcommittee. I appreciate the opportunity to talk to you today about the Supplemental Nutrition Assistance Program, commonly known as SNAP. I am the Acting Deputy Undersecretary for Food, Nutrition, and Consumer Services at USDA and Administrator of the Food Nutrition Service, where I oversee 15 nutrition programs totaling nearly $100 billion per year. The largest of these programs is SNAP, with a total of 40.7 million low-income individuals being served. Today, I want to talk to you about 3 priorities that guide our work at FNS: integrity, self-sufficiency, and customer service. These interdependent principles help us to ensure that SNAP operates effectively, efficiently, and as intended by law. FNS works closely with our state partners to administer nutrition assistance programs that leverage our nation's agricultural abundance. All those involved in these programs at the federal, state, and local level are accountable for the program integrity. In programs of this size, even low fraud rates can translate to billions of dollars in taxpayer money. Therefore, FNS uses advanced data analytics to prevent new and emerging threats, as well as to identify and remove retailers that take advantage of the program. We also work with states to educate and equip them to fight participant fraud. To that end, just yesterday, we announced a comprehensive SNAP fraud framework geared at helping states with the tools they need to combat participant fraud. Another fraud reduction measure, which was included in the fiscal year 19 President's budget, is the National Accuracy Clearinghouse, which improves states' abilities to check for duplicate participation in SNAP across state lines. It's also critical that benefits are issued only to those who are eligible and in the correct amount. For the first time in 3 years, FNS will announce a SNAP improper payment rate for fiscal year 2017 in June. It is worth noting that the OIG's audit findings suggest that state performance bonuses incentivize this bias. The fiscal year 2019 President's budget also called for eliminating these performance bonuses. Another important piece of our strategy is coordinating and enhancing ongoing efforts at the agency. That is why we recently announced the hire of a Chief Integrity Officer to foster greater collaboration and to leverage lessons learned across each of our 15 nutrition programs. Another key agency priority is self-sufficiency. Nutrition assistance programs should not only be measured by how they provide for those in need, but also how they support the transition to independence for those able to move beyond government assistance. There are approximately 15 million working-age, able-bodied adults on SNAP. Of these, over 9 million are not working. We can and we should do better. FNS recently published an advance notice of proposed rulemaking which received over 22,000 comments on how to best help able-bodied adults without dependence, which we refer to as ABODs, move back to stable employment. As the economy continues to improve, there is no better time than now to discuss how we can more effectively help those ABODs move to self-sufficiency. I recently visited an employment and training site and had a chance to talk to women training for non-traditional jobs. The excitement in their voices about the prospect of a new career and a new chapter in their lives was truly empowering. ENT programs can have a profound effect on low-income Americans, lifting them from poverty to prosperity. FNS SNAP to Skills Project and our ENT Learning Academy are just two of the ways we are working with states and local partners to identify and share best practices and improve our employment and training outcomes. Finally, we have the responsibility to provide the best customer service to all of our stakeholders. Though the federal government develops SNAP policy and conducts monitoring and oversight, state and local agencies are ultimately responsible for delivering program benefits. We must empower them to successfully execute this responsibility while also holding them accountable. I've met with SNAP administrators from across the country to hear from them on what is working and what is not. Many have indicated they are looking for more flexibility and less regulation so they can better serve their local populations. To that end, we recently issued guidance to improve customer service by expanding allowable activities for states that use non-merit system personnel in their call centers. As we move forward, we will continue to identify ways to improve integrity, increase self-sufficiency, and deliver high-quality service to all of our customers. As Secretary Perdue says, we can do right and feed everyone. I look forward to continuing to work with Congress to achieve that goal, and I'm happy to answer any questions. Thank you.
Thank the gentleman. Ms. Laren, you're recognized.
Chairman Jordan, Chairman Palmer, Ranking Member Krishnamurthy, Ranking Member Raskin, and members of the subcommittees. I'm pleased to be here today to discuss GAO's prior and ongoing work on USDA's Supplemental Nutrition Assistance Program known as SNAP. Specifically, my testimony today will address our work on SNAP employment and training programs, improper payment rates, recipient fraud, and retailer trafficking. First, regarding SNAP ENT, according to our analysis of USDA data, about 14% of SNAP recipients were subject to work requirements in an average month of 2016. But only 0.5% of SNAP's 43.5 million recipients participated in a SNAP ENT program that year. SNAP ENT programs are generally designed to help SNAP recipients increase their ability to obtain regular employment through services such as job search and training. States have broad flexibility in how they design their ENT programs, and we found that they've made various changes to these programs in recent years, such as increasing partnerships with state and local organizations to deliver services, and increasing their focus on able-bodied adults without dependence, or ABODs. States we talked to noted that in recent years, ABODs have become increasingly subject to time limits, which prevent those recipients from receiving benefits for more than 3 months unless they're working or participating in an employment program. Regarding improper payments, in 2015, USDA reported that 3.66% of all SNAP benefits paid in fiscal year 2014, $2.6 billion, were improper. GAO reviewed USDA's SNAP improper payment rates in 2016, and we found that state and federal policy changes likely affected these rates in the last decade. Specifically, we found that policies that simplified program rules likely lowered improper payment rates, while other policies may have increased them. USDA did not report on improper payments in 2016 or 2017 due to data quality issues identified by the department and by the USDA IG. However, USDA has been working with states to resolve these issues and is expected to release new estimates by June 30th of this year. Regarding recipient fraud, in 2014, we reported that states faced several challenges in combating recipient fraud. For example, we found that USDA guidance on the use of data analytics to detect fraud lacked specificity, and we recommended that USDA develop additional guidance. We also found that tools recommended for monitoring e-commerce or social media websites for potential fraud were ineffective. USDA's recently released fraud framework may help address some of these issues. Additionally, we recommended that USDA consider revisiting its financial incentives to better support cost-effective anti-fraud strategies, but the department decided not to make changes to address this issue. Finally, regarding trafficking, in 2006, we reported that SNAP was vulnerable to retailer trafficking. For example, we found that USDA did not have a system in place to ensure that retailers at highest risk for trafficking were quickly targeted for monitoring, and we recommended that they provide earlier, targeted oversight to these stores. We also found that USDA's penalties for retailer trafficking may have been insufficient to deter traffickers, and we recommended that penalties be increased. Since we reported on these issues, USDA has established risk levels for each retailer and proposed rules to increase penalties. However, USDA has not finalized these rules, and as of fall 2017, these rules were considered inactive. In conclusion, many of our nation's most vulnerable citizens rely on SNAP to obtain an adequate and nutritious diet, and USDA has taken some steps to improve the integrity of the program, but more could be done. GAO continues to examine these issues for the subcommittee and looks forward to providing additional information later this year. This concludes my statement, and I'm happy to answer any other questions you have.
Thank you, Ms. Laren. Mr. Adolphson.
Chairman Jordan, Chairman Palmer, Ranking Member Krishnamurthy, members of the committee, thank you for the privilege of testifying. A couple years ago, I sat in an FBI office in Portland, Maine, presenting suspicious food stamp data to FBI special agents and investigators from the USDA. In my role as Chief Operating Officer at the Maine Department of Health and Human Services, a colleague and I had discovered what we believed was a massive case of welfare fraud. The federal officials agreed, and after a lengthy investigation, Ali Daham, the owner of ARAM Market in Portland, was found guilty of millions of dollars in SNAP and other welfare fraud. Daham, who is also fraudulently receiving SNAP benefits himself, had been trading cash for food stamps in his corner store for years. It is one of the largest fraud cases in Maine history. The Maine story is not unique. There are cases like this around the country, even as some claim welfare fraud isn't a problem or that it is a victimless crime. It is a big problem, and the victims are very real. Fraud steals from the truly needy and traps families' independency. An award-winning fraud director in one Ohio county said he believes the real fraud number is as high as 20%, 1 in 5 cases. When states look for food stamp fraud, they find it. What's indefensible is that many don't bother to look. Too many view federal food stamp funds as free money, instead of as a resource to be carefully guarded. To stop trafficking fraud, where benefits are traded for cash or drugs, we should limit the number of users of an EBT food stamp card, require people to cooperate with fraud investigators, and empower states to shut down retailers that steal benefits. To stop eligibility fraud, those cases when individuals get on food stamps when they're not eligible, let's require real-time reporting, conduct regular checks, and close loopholes. There's much more detail on these solutions in my written testimony. Change needs to happen, that much is clear. But the best way to stop welfare fraud is to get people off welfare and back to work. And not all food stamp fraud happens at a street corner drug deal or in a dingy convenience store. The fraud that harms the most people happens with a government stamp of approval. Abuse of waivers of work requirements for able-bodied adults has disfigured federal law and waived work for millions. So instead of working, able-bodied adults with no kids on food stamps don't work. Despite record low unemployment and millions of open jobs, 3 out of 4 don't work at all. A federal law allows waivers only when unemployment is at least 10% or there are not enough jobs. But there are 1,200 counties and cities where work requirements are being waived, and just 42 of those have unemployment above 10%. Today, there are a record number of open jobs available in the country, 6.6 million open jobs. California is at their all-time low unemployment, and yet they have been granted a statewide waiver of work requirements for more than 800,000 able-bodied adults with no kids. One of these California counties has 2.2% unemployment. These waivers should not be allowed any more than swapping an EBT card for drugs is. The waivers for work requirements were meant for tough economic times. Instead, they continue to be handed out in the best economy in decades. That is the definition of fraud. It's not right, and it's not how the program should work. It robs able-bodied adults of the opportunity and dignity that they gain through the power of work. This waiver fraud is possible because previous regulations and guidance from USDA has allowed it, and in the past even encouraged it. By allowing the use of bad data, old data, and gerrymandering, California and 33 other states waive work for more than a third of the country. It is clear that changes are needed to battle the significant problem of trafficking and eligibility fraud. But the best way to improve the integrity of food stamps is to stop this waiver abuse and move millions of able-bodied adults from welfare to work. Thank you. I'm happy to answer any questions.
Thank you, Mr. Adelson, excuse me. Ms. Dean, you're up.
Chairman Jordan, Chairman Palmer, Ranking Member Krishnamurthy, members of the subcommittee, thank you for the opportunity to testify this morning. I'm Stacy Dean, the Vice President for Food Assistance Policy at the Center on Budget and Policy Priorities, a nonpartisan policy institute here in DC. I plan to talk about 3 things this morning: the vital role of SNAP, the vital role of program integrity in SNAP, and the likely impact of the pending House Farm Bill on SNAP. First, SNAP. SNAP is a highly effective anti-hunger program. Today, it helps about 40 million low-income Americans afford a nutritionally adequate diet by giving them benefits through a debit card that they can use only to buy food. Benefits average $1.40 per person per meal, and 1 in 8 Americans participate in SNAP, which reflects SNAP's important role in addressing the extensive need across the country. SNAP is an entitlement, so anyone who qualifies can receive benefits. That enables SNAP to respond quickly and effectively to support low-income families and communities when the economy turns down and need rises. So while SNAP enrollment expands when the economy weakens, it also shrinks when the economy recovers. SNAP is also an important work support, helping workers both when they are between jobs and supplementing their low earnings. And that's why looking at the work status of participants at a specific point in time substantially overstates their joblessness. Mr. Lips noted that in an average month in 2016, about 9 million adults participating in SNAP did not have earnings, and we agree with that. But about 4.5 million of them worked within a year, so they were participating on SNAP when they were temporarily unemployed. And of the other 5 million, over a third of them couldn't work due to caregiving responsibilities, and most had working spouses. Nearly a quarter had a disability or a chronic health condition that limited their work, and close to a third were going to school or were not working. Second, let me turn to program integrity. USDA and states take their roles as stewards of SNAP very seriously, and they emphasize program integrity throughout SNAP's operations: participant eligibility, state accuracy, and participants redeeming benefits at SNAP retailers. The authorizing committees have mandated some of the most rigorous program integrity standards and systems of any federal program, and they do provide rigorous oversight of SNAP's accuracy and fraud detection and prevention systems. Numerous measures ensure the accurate assessment of household eligibility during the eligibility determination process, as ongoing checks and reassessment of eligibility. The same is true with respect to the proper use of benefits, an area of fraud prevention and detection where USDA plays a very significant role. These measures are designed to detect and prevent honest mistakes, careless errors, systemic mistakes, and the less frequent problem of intentional fraud. CRS did an excellent job summarizing U.S. SNAP's program integrity and error reduction efforts in a recent report, and a few of its observations bear repeating. First, errors are not the same as fraud. Many conflate the two. Fraud is an intentional activity that breaks federal or state laws, but program stakeholders, particularly recipients and states, may also inadvertently err in ways that can affect benefit amounts. Some acts, such as dual enrollment, could be error or fraud, and it's important to calibrate the response to the cause of the problem. Second, SNAP fraud is rare. According to all available data and reports, the illegal and inaccurate activities that do occur are serious and merit a very serious response. However, they do represent a small fraction of SNAP activity overall. We strongly favor efforts to improve program integrity so long as they are warranted by evidence, are cost-effective, and would not meaningfully impede program access. Third, let me turn to the Farm Bill. Unfortunately, H.R. 2, the Farm Bill that the House will likely consider next week, could reduce SNAP's effectiveness. According to CBO, it would cut benefits to poor households by more than $17 billion over the next 10 years and would cause more than 1 million low-income households with more than 2 million people, particularly low-income families with working families with children, to lose their benefits or have them reduced. It includes sweeping new work requirements that would likely prove unworkable and increase hunger and poverty. The bill would force states to develop large new bureaucracies but do little to increase employment and leave substantial numbers of low-income people with barriers to work, such as very limited skills or chronic health conditions, with neither earnings nor food assistance. The Farm Bill could have been a bipartisan effort that strengthened SNAP, promoted work, and shored up program integrity. Instead, it's largely a package of harmful, unworkable, and untested policies that will weaken the program. Again, thank you for the opportunity to testify, and I am pleased to answer your questions.
Thank you, Ms. Dean. Gentleman from Alabama is recognized for 5 minutes of questioning.
Thank you, Mr. Chairman. Listening to your testimony, Ms. Dean, and I find it interesting that some of the things you quoted there about how this will harm people to go to work. I grew up dirt poor. I mean, my father had an 8th grade education. He's blind in one eye. And I was able to get out of that situation by working, not by going on a government program. What I want to point out to you is work requirements were implemented in Kansas, the state of Kansas. And I just want to read some of the results. There's Jason, who was previously unemployed, was on food stamps for 4 years. After the work requirements, he got a job and he's earning $45,000 a year. Do you have a problem with that? I didn't think you did. Amy was previously unemployed. She's on food stamps for 2 years. She's now earning $27,000 a year. Matt was on food stamps 3 years. He's now earning $34,000 a year. Sarah was on for 3 years. She's earning $37,000 a year, and I could go on. And, you know, the thing that really bothers me about all this is that it comes across to me that some folks really do want to see people remain dependent on the government. And that, I just can't believe it. I mean, I'm going through the Farm Bill. I've read the provisions in it for the improvements in SNAP and giving people the ability to stay on food stamps while they're getting job training or getting a job or volunteering. And it's just beyond my comprehension that anybody would oppose that for able-bodied adults without children. I've even heard one of my colleagues say that it would violate child labor laws. And I just want to emphasize, this is able-bodied adults without children. It doesn't violate any child labor laws. I tell you, the opposition to it violates the laws of common sense. I really believe that. Mr. Adolphson, one of the reasons the current work requirements in SNAP have been largely ineffective is the widespread use of waivers, as you pointed out. And I think in one of the, I think it's the GAO report, Ms. Laren, you point out that only about 0.5% actually took advantage of the training out of 43 million people. only about 200,000. Is that correct?
Yeah, 0.5% of SNAP recipients participated in the SNAP ENT program. You know, the vast majority of SNAP recipients are not able-bodied adults. Many are exempt from work requirements. Those include children, the elderly, the disabled. But 15% were work registrants in 2016.
That'd be about 6 million, right?
Yeah, that's correct.
15% of 43 million is a little over 6 million. My point here is that there's right now about 6 million available jobs. If that 15% of able-bodied who do no work entered into the workforce, we could pretty well fill those positions and still provide the benefits to the people who truly need them, the disabled, the people, low-income families with children. So what we're really trying to do is one other statistic on this that gets me is that I believe about 63% of the people who are on food stamps, Mr. Dawson, correct me if I'm wrong, are under 35 years old. Is that correct? No, no. A little over half, a little over 50% of the people who are on food stamps, on SNAP benefits, are under 35. Is that correct?
That sounds right, Congressman.
Yeah, and I think a little over 40% of those are men. It's the guy that was sitting on the front porch, Mr. Chairman, drinking, you said a cup of coffee, may have been drinking a beer, I don't know, I didn't drive by. But that really bothers me. And again, having grown up the way I did and knowing that the only way out of that situation is a good job, a good paying job, as my colleague from Illinois pointed out, that is the best anti-poverty program, is a good paying job. It's the best thing you do for an individual's health. Would you agree with that, Mr. Adolphson?
Yeah, I think we've seen the results in states that have brought work requirements back into play. In my home state of Maine, just a year after implementing that requirement, the incomes of those individuals that left food stamps more than doubled in just 1 year. You mentioned Kansas. We've seen that work. I think people aren't participating in ENT because it's not required. It's typically done only as a voluntary thing, and there's no penalty if they don't work or if they don't participate.
Mr. Chairman, my time's expired. I just want to close with this, that as a result of the Tax Cuts and Jobs Act, we now have record unemployment. We've got higher wages. There are over 6 million job openings, and the economy is poised to grow at an even greater pace. And I can't think of a better time than this right now to help low-income families get out of poverty, get off government dependence, and get a job and really get themselves onto a brighter future. I yield back.
I thank the gentleman. The gentleman from Illinois is recognized. The ranking member, excuse me.
Ms. Dean, hi.
Sorry.
I think that Mr. Palmer had some points he made, and I think a couple of them were directed toward you. Do you want to respond to any of those?
Thank you so much. If I've left anyone with the impression that we don't believe at the center that work is the single most powerful pathway out of poverty, then I did a poor job. Of course, work is crucial to family well-being, economic success. That's why the center does so much work on key work supports like the Earned Income Tax Credit, Medicaid, and SNAP, which is a program that supports low-wage working families. The problem is that a lot of work does not pay, and so in Mr. Jordan's example, the custodian at the second shift plant, the teacher's aide in that second grade teacher's class could well be SNAP participants with inconsistent hours, low pay, and no benefits. And so the program does play a vital role in supporting work. The concern I have about HR 2, and I'll just be brief on this, is that before you even get to the question of the work requirements and whether the services that would be offered would be the quality kinds of things that Mr. Lips talked about earlier, 7 million people would have to file a form every month demonstrating that they were working 20 hours a week or were exempt. So a single mistake, and this is where I think we talk about people getting caught in the net. A mom with a young kid who was sick has to prove that the child was truly sick to the satisfaction of a caseworker. We are suggesting that large, massive bureaucracies can make mistakes and put benefits at risk. So we are putting benefits to families with children and workers at risk, and that is a deep, deep concern. So thank you for the opportunity, and sorry, I should let you get back to your question.
So kind of explain to us how, as you mentioned, if H.R. 2 were to go into existence or be passed, that 1 million additional people would essentially go hungry without the food stamp assistance that they would receive.
Well,
otherwise,
I want to be careful about going hungry. It's an important and powerful term. I think we believe without food assistance, absolutely hardship will increase, and families would be at risk. In the case of CBO does say, for example, 400,000 working families with nearly 1 million people would be terminated from food assistance under the bill, which would force states to, or would repeal an option that states have to extend the program. That's just making their lives more precarious. And in the case, you're an example of a child that benefited from ensuring steady, stable nutrition during key developmental years.
and I think that's one of the fundamental issues here, which is that children are in so many of these families that receive this SNAP assistance through no fault of their own, through nothing that they had to do with a mistake on paperwork or bureaucratic errors or anything like that. They may go without the essential food assistance that they have come to rely upon. Is that fair to say?
That's right. It's an untested scheme, which is really unfortunate because the last Farm Bill included $200 million to test very robust demonstration projects to look at different interventions around work so that we would have Congress would have a better sense of what works and what doesn't before obligating billions of dollars to a new system. And in the end, it's true, it's poor families who are at risk under this approach.
And tell us again how many children would go at risk of losing food assistance because of H.R. 2?
I'm sorry, I don't have that number at the ready, but a significant share of the 2 million are families with kids.
I understand. Ms. Dean, your testimony discussed the positive impacts that SNAP has had in reducing hunger and poverty in our country. Yet, I've also heard people say that, our investment in anti-poverty programs such as SNAP has not had any impact on reducing poverty. So can you kind of help us understand the discrepancy in these perspectives?
Oh, it absolutely has. The official poverty measure doesn't include the value of income transfer programs like SNAP, but so that's why the Census Bureau recommends using an alternative measure, the supplemental poverty measure, which adds it back in. And when you add the value of transfer programs, SNAP lifted for the most recent year available more than 8 million people out of poverty, 4 million children. So poverty experts agree it is totally appropriate and preferable to include the value of transfer programs. And when you do that, you see the powerful impact that the safety net has on addressing poverty.
Thank you, Ms. Dean. Thank you. I yield back.
I thank the gentleman. The gentleman from Tennessee is recognized. Mr. Desjardins.
Thank you, Mr. Chairman. Mr. Lipp, you mentioned in your testimony that SNAP is intended to support the transition of able-bodied adults to stable employment. Would you agree that there's a lack of available data from USDA in regards to the amount of time individuals actually receive the benefits?
Yes, sir, Mr. Desjardins. We have some data on that, but it's mostly survey data. We don't, at the national level, have accurate data held on that.
Okay, so would you agree then that it would be very difficult for us to judge the effectiveness of the program at transitioning people off of welfare if we don't even know how long they're on the program?
Yes, sir. I think the more data that we at FNS are able to have, the better we can serve recipients.
How do we fix that?
I think we need to make sure that we can have access to that type of data. States need to be measuring when people are moving on and off of work. Ms. Dean added some follow-up to my statistics on the number of people not working. I don't disagree with those, but I think part of the problem is that so many of these individuals churn on and off work. And the employment and training program is about helping people find long-term stable employment, and that's what we should be measuring on these people.
Okay. States currently receive bonuses for meeting the minimum requirements for administering the program. Is that correct?
That's correct, yes, sir.
Okay. Do you also think that these bonuses may incentivize states to potentially falsify the records to become eligible for these bonuses? And how much are these bonuses?
The OIG did suggest in their investigation that that was a factor in what states did. The bonuses are $24 million a year.
To all states or?
To states. I believe we give them to 8 states with the best error rates and a couple of additional states on improved error rate.
Okay, so they're actually sending money to these states for doing a good job of signing people up to the program?
For processing them well, yes, sir.
It is often reported by states that their error rate is extremely low or even zero. Would you agree that it's important to point out that under current law, the threshold for errors is actually $37?
Yes, sir, that is important to know in calculating what the error rate is.
Do you think that should be changed?
I think it's important that we accurately report what the actual errors are and what people judge that to be, yes, sir.
Okay, so if the threshold is $37, can you speculate how much money may be being overlooked?
I can't speculate that on exactly, but if you consider that the average benefit is $123, I believe $37 is a significant percentage of that.
Yeah, I would agree. Mr. Adelson, you mentioned in your testimony something known as broad-based categorical eligibility, or BBCE. As I pointed out earlier, we have an extreme lack of data when it comes to SNAP recipients. Would you agree that broad-based categorical eligibility, which waives the asset test, is a contributing factor?
Yes, sir. Since we don't collect assets at all, you have a limited view of income and resources available to a household.
Okay, can you go into some more detail on additional problems associated with the BBC?
Sure. The broad-based categorical eligibility relies on a gimmick where states convey a TANF-funded document, usually a brochure, to a recipient, making them eligible. So by handing them a TANF-funded document, and some states don't even actually give it to them, that confers automatic eligibility on them and waives the asset test. It also allows their income level to be much higher than traditional eligibility.
And that kind of cheating the system?
I believe it is, and unfortunately, increasingly large percentage of cases are found eligible through that door. I believe it's over 65% at this point.
Would you say it's possible that some of these programs that are cheating the system are also the states where these performance bonuses are going?
That is fair to say. I do know the current version of the Farm Bill eliminates broad-based categorical eligibility as well.
Right, I agree. As you point out in your testimony, there's quite a bit of confusion when it comes to who faces a work requirement for SNAP and who is exempt, which often leads to states not appropriately enforcing work requirements. Would you agree that instead of several confusing categories, it would be more effective to simply have one category of work-capable adults from age 18 to 59, with exemptions being for those who are pregnant, mentally or physically disabled, or guardian of a child under age of 6?
Yeah, without a doubt, all able-bodied adults should have a requirement in place, a work requirement.
And I think that's an issue that over 80% of America agrees on, whether you're Democrat, Independent, or Republican. So I think that that's a winning issue, and I yield back my time.
I thank the gentleman. We now recognize the gentlelady from New Jersey for her 5 minutes.
Thank you, Mr. Chairman. I agree with everyone that every able-bodied person in this country who has the skills and the opportunity and is free of discrimination should be working, and that the work that they have should pay a living wage so they don't have to supplement it with any kind of government assistance. I recognize that SNAP costs $1.40 a meal. And we're sitting here having this long discussion, making assumptions about people sitting on their porches, not knowing what the hell their problem or issue may be, not even defining what able-bodied might be. But we had no discussion on passing an incredibly generous, outrageous tax bill to the wealthiest 1% of this country, and we had not a hearing, not a committee meeting, not a vetting, not a darn thing, just an opportunity to vote yes or no, and I voted no. I am offended that we make assumptions about people who we may think are able-bodied or should be working when they're only receiving minimal help from government in order to ensure that they are nutritiously cared for, even if they have children or don't have children. The richest country in the world needs to spread some of that generosity to those who need it the most. No one should be hungry, and no one should be questioned about whether or not they're eligible for $1.40 a meal. And this is very offensive to even have this discussion here right now. I want to ask Mr. Laren, no. Who represents the nonprofit? You, Mr. Adelson. What does your nonprofit do?
Our nonprofit is a public policy think tank that focuses on welfare and healthcare issues.
Thank you. So did you all have any opinion on the tax bill, the tax initiative that was passed most recently? And if so, what was it?
We do not engage in tax policy, but I think it's fair to say that in part because of that tax cut, that work now pays like it never has before.
Do you have an understanding that the situation of work availability has a lot to do with the communities in which you live, the education in which you've had, and the color of your skin or your ethnicity? We are having this Pollyanna discussion as if there's equality in this country. There's never been equality in this country, and inequality is at its absolutely highest level right now. So I am particularly offended to sit here and listen to either my colleagues or those who are testifying to suggest that there are people who are gaming a system at $1.40 a meal when 1% of this country has gamed an entire economy. Ms. Dean, I want to thank you for the work that you do and for the information that you have shared with us. I know you must agree that there needs to be better monitoring devices to ensure that those few who shouldn't receive these benefits don't receive these benefits. Do you have anything you'd like to contribute along that line?
Thank you for the opportunity. Actually, I've had, 2 years ago, I testified before a different set of subcommittees, as well as the House Agriculture Committee. We've suggested that states be given better access to some of the kinds of data systems that were built for health coverage, healthcare.gov. The HHS has a big data system that we think would give states quick access when they're talking to someone to verify what they're saying. We do support the proposal to create a national accuracy clearinghouse. We just have serious concerns about the way it's been proposed in the Farm Bill. I think also an increase in resources for fraud investigators, both at the federal level and at the state level, is a welcome idea. Unfortunately, the Farm Bill didn't do that. May I jump in on one point that was raised?
If you do it really quickly, because I have a question for Ms. Laren.
I do want to just raise a point about the success that's often been touted about Kansas and Maine. I do think that often what is reported is what happened after the intervention, but there's no actual comparison data relative to what we would have seen in the absence of the intervention. When you compare employment and earnings rates post-intervention to a year prior, there is virtually no difference. And I think that's really crucial in an evidence-based environment to not pursue an approach without a robust assessment of the facts.
Thank you so much. Ms. Laren, I guess you're best to answer this question. You said that there's a certain percentage of these improper payments that were made. What percentage was that, and what percentage of those were determined to be fraudulent payments as opposed to improper payments?
Yeah, improper payments and fraud are two
completely
different things, right?
I'm not sure everyone does, but I know that.
Yeah, so improper payments occur when a beneficiary either gets too much or too little, less than...
So what percentage, I'm asking a really specific question here, what's your knowledge of the percentage of the that are improper, and of that improper, what percentage are actually fraudulent payments?
We do not know. The only fraud rate that USDA measures is retailer trafficking, which does not cover recipient fraud. So we have no idea what the recipient fraud rate is.
My time is up. I yield back. Thank you very much.
I think the gentleman from North Carolina is recognized for 5 minutes.
Thank you, Mr. Chairman. Under the Obama administration, welfare recipients went from, or SNAP recipients went from 28 million to 44 million. That's a 64% increase. The population under that same time increased by 6%. Ms. Dean, how do you explain that? What would be your reasoning for that kind of spike?
I have two reasons. First was the extraordinary economic downturn that occurred as the Bush administration was ending and the Obama administration was beginning. That was the primary driver of enrollment. But the second is that the share of eligible people was on the rise. So the program now serves, I believe, over 80% of eligible people relative to fewer than 75. So
okay.
Even if the economy improves, the program will be serving.
What is the plan to transition off such a program? I mean, do you have a plan or thought about how you would transition people back into the work environment?
I think what we have now, which is a growing economy and low unemployment rate, is the best path.
Well, we have in our community many others, many wages starting at $13 to $15 an hour, and it's a problem to find people because of the level of some of these government benefits. My friends like to make this a humane argument, but what is humanitarian about keeping people trapped at this poverty level boggles my mind. I think we have failed the American people when we began to perpetrate the idea that by adding people more to a program somehow creates its success. Our ultimate goal would be how do we transition people off the government entitlement programs such as SNAP. Obviously there's kids and there's family situations who we want to back up and support, but for the many people, the able-bodied adults, the people that we're talking, it is a God-given, created ability that many people have different skills and uniques and talents. And when we put up roadblocks, to me, that is a travesty to be able to encourage and to motivate people back into the workforce.
If I may,
Mr. Lips, I'm sorry, I don't have time to respond right now. If I do it, then the question, I'll come back to you. Mr. Lips, what is the total number of SNAP recipients for the last fiscal year?
42.2 million.
And what is the total estimated cost of benefits for those recipients?
63.7 billion.
Okay, for that large of a population, I'm sure that USDA and or maybe FNS has ways to prevent improper payments. Are there any methods or programs of identifying improper payments within USDA FNS?
Yes, sir. FNS provides a lot of technical assistance to states, and they have a lot of training programs on their own. Our quality control system is our measure of how well we're doing in improper payments.
Can you describe the current process or program by which the payments are identified?
Yes, sir. So the quality control process is the issue that we did have a problem with states inserting bias into the process in years past. Prior to my arrival and continuing now, FNS has done a great job of revising that process both at the federal and state level so that we will be able to report an error rate to you this year.
OMB recently tried to address the issue of improper payments with the National Accuracy Clearinghouse, the NAC, in Alabama, Florida, Georgia, Louisiana, and Mississippi. Has this program resulted in any significant reduction in dual SNAP participation?
Yes, sir. It was only tested in a few states, and so, on the size of 40 million recipients, it's difficult to say what's significant, but we think that any ability to root out fraud in the program is significant, and so we did recommend in the President's budget that this be expanded nationwide.
Very good. How do you compare this to the current Paris system?
The National Accuracy Clearinghouse provides a lot of opportunity that Paris does not. Paris is not a real-time check on dual participation, and it has some other issues that can be fixed.
Fair enough. Thank you. If adopted, does FNS have an estimate for total savings across a 10-year period using the NAC, or the National Accuracy Clearinghouse?
Yes, sir. Our estimate in the President's budget was roughly $1 billion over the baseline.
And I gave my word to Ms. Dean that I would come back if I had an extra question. I want to honor that. But let me preface it by saying this. Republicans are trying to be presented here as non-compassionate. I've spent much of my life working in the inner cities of Cleveland, New York, Baltimore. This is about hope, not judgment. This is being able to help families and people find a way to fulfill their God-given gifts and skills and talents, of which we are all uniquely created. That's why we're passionate about this. How do we help? How do we transition this without continuing to create more and more government systems and adding millions and million people on those roles? I want to yield back. I've got 30 seconds. I'll yield that time back to you.
I just wanted to say I think the true measure of success is no food insecurity and no poverty. We tout enrollment in SNAP as I guess a step along the way to that because it is so successful in addressing hunger and food insecurity. But the goal is a country without those two problems.
But when we see a spike from 28 million to 44 million, 64%, that ought to trouble us, not encourage us to say, hey, we're serving, as we've heard today, we're serving the American people. For able-bodied adults, there's a better way, and we must work to find it. Thank you, Mr. Chairman. I yield back.
Thank the gentleman. The professor from Maryland is recognized.
Mr. Chairman, thank you very kindly. First, I just want to say that I agree that all able-bodied Americans should be engaged in productive work and not sitting around all day tweeting or filing bankruptcy or watching TV. And as Chairman Jordan points out, that can get the rest of the population very angry to see people who are not participating in a meaningful way in the workforce. Now, the premise of some of the questions seems to be either you're collecting SNAP benefits or you're working, and that puzzled me because I always thought that working people could get SNAP benefits if they were otherwise eligible. Ms. Dean, can you clarify that for me?
You are absolutely correct, and unfortunately, too many jobs pay too little or offer too few hours, and so we have millions of people who qualify for SNAP. About of the working age folks on the program, I think 65% include a worker of the able-bodied definition.
All right, so I want to be clear about that. You're saying nearly 2/3 of the people who receive SNAP benefits are able-bodied working people who are in fact working, but not making enough money to support their family in a way to avoid food insecurity.
Within that able-bodied age group, and the number's even higher amongst families with children. And of course, if you look whether they were working before or after on SNAP, it's even higher. SNAP is there both as a form of unemployment insurance and a low-wage supplement. So again, when thinking about work interventions, it's important to think about who are we targeting, an individual who will rapidly re-employ within a month or so on their own, and therefore spending money on expensive training might not be the best first solution. Is it someone who actually needs more robust intervention, or is there something else going on?
Yeah, so, but I was moved by Chairman Jordan's instructive example at the beginning of two people going off to work, the third person sitting at home, watching TV, tweeting all day, whatever, and those people feeling uncomfortable or irritated about it, but in fact, because of the work requirement, that person's likely to get in trouble if they're really ripping off the system. If everything's working right, it's more likely that one of the two going to work could be using SNAP benefits for their family. Is that right?
I think I gave the example of other folks in their workplace who might be earning lower wages and would benefit from the program. Yes, absolutely.
Okay, but in any event, it's misguided for us to think of the collection of SNAP benefits as somehow opposed to work, when in fact, as you're saying, a majority of the people collecting SNAP benefits are working.
Yes, you're correct.
Okay. Mr. Adolphson, let me just ask you quickly, do you think that Americans have a strong work ethic?
Yes, I think we're the greatest country in the world, and we're built on hard work.
All right, good. Then we agree on that. Thank you. But I want to come back to what the work requirements are currently for people in the law. And Ms. Dean, could you recite for us what the work requirements are for people who are nonetheless still applying for SNAP benefits?
Sure. There are two categories. The first is the population between 18 through age 59 without children under age 6 and who are not essentially receiving a disability check or very ill. That group has to register for work, and they are the pool of people that states can obligate or offer job training to. States have a lot of flexibility on who they decide to enroll, and so when Ms. Laren said only 200,000 were enrolled, that's not because the other group was refusing, it's because that's the group that states are serving. The second group is, a subset of that is between the ages of 18 to 49. They are subject to a 20-hour-a-week work test. They may not participate for more than 3 months out of any 3 years, unless they're exempt, and that group is not offered a job training slot at the end of as a condition of work. States can, but the vast majority don't. So we call it a time limit, not a work requirement.
Okay. Ms. Laren, I wanted to come to you about a question, which is, states presently have the flexibility, as I understand, the discretion to impose additional requirements on recipients for work. Are there any federal restrictions on their ability to do that, and what are some of the restrictions that states have imposed beyond the federal requirements?
Yeah, I'm not familiar with
okay.
individual state.
Okay, I can research that separately. Ms. Dean, let me come back to you. But I don't know, I know that your think tank has worked on tax policy, and I've been able to benefit from that. Were there any work requirements imposed on the big tax bill that gave hundreds of billions of dollars to wealthy investors Did we require them to prove that they were actually working the way we require under the SNAP program?
I'm not an expert on that subject, but I believe the answer to that is no.
They could be collecting the income passively through corporate dividends and interest and so on. I yield back, Mr. Chairman.
Yeah, but it's their income. I mean, that's sort of a fundamental difference. It's not the taxpayer dollars getting funneled to the government. Mr. Adolphson, let me just run through some basics here. What's the food stamp overall SNAP program population today? What's that number? How many people?
42 million.
And is that increased or decreased in the last decade?
That is increased.
Increased from what to what? Do you know the numbers?
17 million in 2000 from 28 million in 2008.
Significant increase, right? How about in dollars? What are we spending on it right now?
It's been as high as nearly 80 billion. It's at about 70 billion right now.
And it was maybe, what was it before? Less than half of that?
Less than half that.
All right. And then how many of that 42 million are in this category we keep talking about, able-bodied adults?
20 million.
20 million. And of those 20 million, how many are not working and yet still receiving the benefit of that 20 million subset?
62%, so a little more than 10 million.
More than 10. So we got 10 million people of the 42 million who were able-bodied and not doing anything to get the taxpayer benefit.
That's correct.
And then of that subset, how many are able-bodied adults with no kids who are not working and still getting the benefit?
Sure. About 4 million, 75% don't work at all, and about 3 million are in areas where that requirement is.
Well, Mr. Raskin just said that that's not the case. There's a work requirement now, but you're telling me there are 4 million people, able-bodied, no kids, who are doing nothing and still getting taxpayer money. How can that be?
Because of the waivers of that requirement.
Because the states have waived it, right? And they're waiving it at a time when the economy is pretty good. In spite of the tax cuts that the other side keeps saying are bad, the economy is pretty good right now, isn't it?
It's very good, and there are a lot of...
What's the unemployment rate right now?
Under 4%, I believe.
Isn't it like the lowest it's been in like 18 years?
15 states have their all-time low unemployment.
All-time low. And yet we still have 4 million people with no kids, able-bodied, who could sit on the front porch and drink coffee and read the paper while everyone else is going to work, right?
They could do that.
They could do that. They may not be doing that. They could be tweeting, as Mr. Raskin points out. They could be watching TV. They could be doing that. But in our example, they're sitting on the front porch, reading the paper and drinking coffee.
Yeah, the average American male spends 21 hours a week watching TV or playing video games, and we're asking...
Wow, I didn't know there's that much sports on TV. That's amazing. Okay, so now, and all we're saying is that group, those 4 million, should probably have to do something to get taxpayer dollars. That's all we're saying, right?
That's correct. And
what's the average length of time someone is on food stamps today? How long are they on? Just take the general population.
The overall population, about 7 years.
7 years? How about that 4 million who are able-bodied with no kids who aren't working? How long are they typically on?
For about 20% of that population, it's the same number.
7 years? So we got able-bodied people with no kids getting something from the taxpayer, not having to do anything, and they can do it for 7 years?
If there's no work requirement and they don't go back to work.
Would you support not only a work requirement, would you support a time limit? Like saying, you know what, if you're an able-bodied adult, we're going to help you do some kind of job training, some kind of work requirement, but if you're not willing to engage in that, there is a limited amount of time we're going to let you live off the taxpayer, not live off the taxpayer, get a benefit from the taxpayer if you're an able-bodied adult not willing to work.
Yeah, that type of time limit has been very effective in the cash assistance program.
Mr. Lips, would you support a time limit?
Mr. Chairman, we don't. Mr. Chairman, we'd be happy to have a discussion with you about that. The administration doesn't have a position on that at the moment.
Ms. Dean, do you support time limits?
No, and I believe the numbers Mr. Adolphson quoted include senior citizens and children. The average length of time for, say, someone who's 65 and a low fixed.
But he also said, I asked him that general question, but I also asked him about the 4 million who are able to work, who are in the category of 18 to 59.
They already face a time limit, 3 months out of 36, unless they live in a waived area, which covers about 1/3 of the country right now.
Well, unless they lived in a waived area, it's kind of a big exception.
Correct.
Yeah, a huge number of the population. So I guess, are you for a time limit for everyone? Not just.
Absolutely not.
And do you believe, Ms. Dean, do you believe deadlines impact behavior?
With my kids, that's for sure.
Yeah, with everyone. They certainly do with Congress. Congress couldn't get anything done if there wasn't a deadline on something. So deadlines always impact behavior, but somehow we can't have that for people receiving a benefit from the taxpayer. It can't be a deadline?
I don't think the jobs that are available today are paying or delivering.
You got to come to the 4th District of Ohio, because I guarantee you they are. I know what it's like. Every single employer I talk to is looking for someone. There's help wanted signs in every single business, and many of them pay very well. And frankly, what employers are most looking for is someone to show up. And if they'll show up, they'll give them the training to get a job that does pay a lot more than the, what was the example you used, the custodian worker at the school? A lot more than that.
But I think that's an area where perhaps you and the program Mr. Lips mentioned and I have an agreement, which is training that is offered to help bridge the skills gap and to give employers the employees that they want, I think is something that would be terrific.
Mr. Adelson, I got just a few seconds here. Is there an asset test for people who get food stamps?
Generally, no.
Generally, no. So just to sum it up for the taxpayer, we've seen a doubling, more than doubling of the food stamp population in the last decade, from 30-some billion to close to 70 billion in spending. Of that, 42 million who are in the food stamp program today, 15 million are able-bodied, 15 to 20 are able-bodied adults. Approximately 10 million able-bodied adults who aren't working, and 4 million of those have no children. And yet they can stay on the program potentially 7 years, and we don't even ask them what kind of assets they have in place. Is that all fair?
That is fair.
That's why we got to change this program. With that, I recognize the gentleman from California, or we got to go to this side, then we'll come back to Mr. Groth, and the gentleman from California, and then we'll come back to the gentleman from Wisconsin.
Thank you, Mr. Chairman. And I do feel the frustration on both sides here. I'm old enough to look at criminal justice reform and see where we've come to some mutual agreements on how we should approach that in evidence-based research. I was in local government. I was very active in building a new juvenile hall for our county in the Bay Area. We built it. When we built it, we were told by the judges it wasn't big enough. I went out there recently. It's at 65% of capacity. I asked the juvenile probation officers what happened. They said, because we instituted largely nonpartisan evidence-based research, including helping families who are falling through the cracks. So, Ms. Dean, it's very frustrating. I don't think any of us disagree with the idea that we would like people to be able to be self-sufficient. But we also know, I've sat in meetings in my district, very different from Mr. Jordan's district in the Bay Area, but I've sat in meetings with UC students who got 4.2s, got into the University of California, the best public university in the world, and they talk about housing problems, but also food problems. So somewhere in here we can make this system work. When I was in the legislature in California, we were very low in terms, and we still are low in terms of our activity on SNAP, but a lot of it was because the state and the counties didn't want to deal with the bureaucracy. So how do we get this discussion turned around like we did with criminal justice reform, and we're not there yet, but we've come a long way to agreeing with what works, to have evidence-based research that is truly impartial so that we give these people the support they need so we get the results we all want?
I think the first thing to do is to wait for the results of the 10 pilots that the last Farm Bill funded. They should be coming back, I believe, within the next year or two. And those were done on a very high-quality evaluation basis in terms of random assignment, and they looked at different kinds of participants and different kinds of interventions, because then Chairman Lucas and the folks on the Senate side wanted to have information before committing billions of dollars. But I think there's an extraordinary common interest around better job training that gives employers and employees what they want. That, I don't believe, is under debate. The question is a one-size-fits-all 20-hour rule for millions of people in thousands of jurisdictions around the country the right approach, and who does it put at risk? And so I feel there is a lot of common ground to pursue a conversation here.
I appreciate that. Mr. Chairman, I'd like to yield the balance of my time to Mr. Ruskin.
Thank you very much. I appreciate it. Ms. Dean, let me come back to you for a second. Why would someone need SNAP benefits if they're working? and they're playing by the rules, and they're going to work every day, and they're packing their lunch and so on, why would they still need SNAP benefits for their family?
A couple of reasons. One might be that they say they have committed to work 35 hours to their employer, but their employer in any given week only offers them, let's say, 12 hours one week, 27 another. So
what job categories might that account for?
Retailer, home health aid, all kinds of jobs where the employer controls the hours, not the employee, right? They can't take a second job because they have to be available for the first one. And low pay.
Yeah.
The reality is $8 an hour still can qualify a family for SNAP.
How many people lost their jobs after the 2008 mortgage meltdown crisis, which accounted for a large part of the dramatic increase in people on SNAP after President Obama took office from, who was that?
President Bush.
After President Bush, yeah.
Mr. Raskin, I'm sorry, you may well know the answer. It was millions and millions. I don't have the number.
My recollection was 11 million people lost their jobs. Something like 12 million people lost their homes. There was massive dislocation and poverty in the country, and obviously that was the major cause for people going on SNAP benefits. And because we have a very strong work ethic, as I think we all agreed, nobody's proud of that, but we're in a country that stands by its own people, and we take care of our own, and if our people fall on hard times, we take care of them. Well, why do states create waivers to make the program go on longer or to create more relaxed requirements?
The Office of Inspector General at USDA did a report on why states seek waivers from the 3-month time limit. The first reason was that states, many of the states believe that it is a very harsh policy, and so they do it because they think the underlying policy is unfair, and they seek to waive unemployed workers from it. The second reason is the rule is incredibly complicated and error-prone, and not wanting to contribute to errors, they like to relieve as much of the state as they can. The third reason, and in California is an example of this, is they want to run their own employment and training program. Again, they don't want the one-size-fits-all mandate of the 20-hour rule, and they offer alternative programs, granted not across the state or for all of the individuals, but they have their own approach. And so that generally explains the three main reasons.
I yield back, Mr. Chairman. Thank you.
I thank the gentleman. The chair now recognizes the gentleman from Wisconsin, Mr. Grothman, for 5 minutes.
Thank you. First of all, I'll point out, and I have to point this out to some members of our Ag Committee too, I think there are many jobs in my district in which they will train you for the job. This idea that you need to go through some government agency to get job training before you can find a job is just preposterous. And we have so many job training programs out there already, but the idea that we have to expect people to go through a formal job training program before they can find work, you got to get in the real world. But since you guys are experts on these nutrition programs, why, wherever I go in Wisconsin or when I ask people in Washington, do they sell food stamps for 50 cents on the dollar? Could somebody give you an opinion why that's so, or wherever you look?
Congressman, it's pretty easy right now in some states in particular that aren't really looking for that type of fraud. For example,
Not fraud. Why is it being sold for 50 cents a dollar? I mean, I really can't figure this out, because if, hypothetically, when you get these food stamps, it's not that big amount. But wherever I go, you can buy them for 50 cents on the dollar whenever I ask. So the question is, why? I mean, it shows that there must be something so fundamentally wrong with this program that people are in essence selling a $20 bill for a $10 bill. But that's what's going on, right?
we had one store in Maine that was giving 60 cents for a dollar, and the store down the street that was giving 50 cents reported them because they were undercutting their competition. This is done so that they can turn the benefit into cash. So, right?
I know, but there's something wrong. You understand what I'm saying? If I have $20 in my wallet today, I don't sell it for $10. It must mean there are so many food stamps floating around out there that people don't need for whatever reason. Maybe they're cheating on the system, maybe they're going to the food bank. Could somebody tell me why you can again and again sell food stamps for 50 cents on the dollar just about everywhere?
They're using it for things other than food.
Well, and that's apparent, but why wouldn't you sell them for 90 cents on the dollar? Why is this fire sale as people try to get rid of food stamps? Mrs. Dean, do you have an answer for that? Why wherever you look, they're selling them for 50 cents on a dollar?
That's not my experience, Mr. Grothman. Families use these benefits for food.
When you ask people, say in low-income housing areas, or when you ask people at the convenience store or grocery store how much they're selling food, it's always 50 cents on a dollar. It bothers me that so many people who set themselves up as experts on this program don't know that that's what goes on in this country everywhere. Do one of you other guys want to guess, Ms. Laren?
When we were looking at recipient fraud in 2016, what we heard is that some people were making very difficult trade-offs between paying their rent and paying food. And if they weren't getting housing assistance, sometimes they would sell their food stamps or their SNAP benefit in order to get the cash for housing. But
do you talk to people who get into this housing, the landlords and that sort of thing, as to whether people are choosing between food and housing?
yeah, some landlords told us that they would take food stamps or SNAP benefits for rent. There are some people who are making those decisions. But
I would strongly suggest you guys get out and talk to more people. But I'll give you another problem we have out there right now. Again and again, when it comes to low-wage jobs, I'm having employers tell me that people either won't work or cutting themselves off at like 20 hours a week because they're afraid they'll lose their benefits. And of course, that doesn't mean SNAP. It means you begin to dig into your low-income housing, and it means you begin to dig into your Medicaid, and it, you know, whatever other benefits are out there. Do you believe that the SNAP program is one of the reasons why so many employees say that I can't take a raise or I can't work more than X number of hours a week? Is that one of the reasons?
If I may answer, no. The program has several earnings disregards that allows people to basically earning more results in a larger monthly income. But I will say that H.R. 2 would reimpose a benefit cliff and take away one of the key earnings incentives in the program that allows people to earn their way up the ladder.
Could you guys guess as to why it is common for employers of people making minimum wage to $15 an hour not want to make more money in our society?
I would say the bigger problem, Congressman, is people not working at all. That's what we find in the data, is that they're not actually going to work, those able-bodied adults on the food stamp program.
Well, I'll give you the answer because my time's about up here. The answer is the Earned Income Tax Credit encourages you to work and make a little money, but not a lot of money. That's why so many people want to make some money, but not too much money, because when you make too much money, you lose not only your other benefits, but you lose your Earned Income Tax Credit too. But there's your answer.
In closing, I just want to make a couple of points that we're having this discussion about the value of work, and during the worst depression in the history of the country, the Roosevelt administration set up a worker program that paid people, but they had to work. And I think a lot of that was not just because, you know, they didn't want to spend money. It was the dignity of work that, particularly at that time in our nation's history, no one wanted to get really wanted to get a handout. They wanted to earn it. I think that's a big part of what we're talking about, is individual dignity. And even during the, with the Clinton welfare reform bill, there were time limits on that. But the whole point is really this, and I think my colleagues and I would agree on this, that this country will never truly achieve its fullest potential until we're able to unleash the enormous talent and intellect and imagination of all of our people. And that's the thing that concerns me more than anything else about where we are in terms of welfare, is the millions and millions of Americans who've been trapped in that system, and the quality of all of our lives have been diminished because of that, because we are not able to enjoy the enormous talent that is trapped in that system. So I thank our witnesses again for appearing before us today. The hearing record will remain open for 2 weeks for any member to submit a written opening statement or questions for the record. If there's no further business.
Mr. Chairman, could I have a closing remark as well?
The gentleman is recognized.
Thank you very much. And I just wanted to also try to close on a note of unity. I think all of us agree that we want people who are able to work to be working in a productive way, contributing to our society. That means we need good wages and fair wages. I've always been a champion for the right of people to organize and to have collective bargaining in the workplace. And the minimum wage was a great historic triumph. I think it's wrong that there are people who are working full-time who can't support their families without SNAP benefits. But I think we've got to look at that as a key part of the equation of reducing SNAP payments to make sure that everybody is making not just a minimum wage, but a living wage. And finally, I would hope that this whole discussion about the Farm Bill and about SNAP does not take us into an area where we're denigrating the work ethic of the American people, who I think are the hardest working people on earth. And we are a people that's committed to supporting our families, but we're also a people that's committed to supporting one another through the ups and downs of the economy. With that, I yield back to you, Mr. Chairman.
I thank the gentleman. And my final comment in that regard is that with the economy growing the way it is, with the demand for labor, the things that will determine what you make is work experience and skill level. And I really believe that we're on a path to help people achieve higher skill levels, better education, and once we get them into the workforce, to be in a position where they can earn a livable wage. And I don't want them to just earn a livable wage, and I don't think my colleagues want that either. We want them to prosper. And the key to that is to be able to work. If there's no further business, without objection, the subcommittee stands adjourned.